Welcome to the LinkedIn Live with ICHOM and CAPIDEV to talk today to you about ICHOM accreditation. We look forward to the next half hour having a conversation about our efforts to guide and recognize leaders in value-based healthcare. I'm Jennifer Bright. I'm President and CEO of ICHOM, the International Consortium for Health Outcomes Measurement. And I'm joined today by my colleague Faris. And Faris, please introduce yourself.
Yes, thank you, Jennifer. Faris Saadi here. I'm a partner at CAPIDEV. CAPIDEV is an ICHOM implementation partner since 2018 and recently an accreditation partner. I'm also very glad to be here with you, Jennifer, today to talk about how the ICHOM accreditation could help actually guide implementation and get the right also institutions recognized. So perhaps we would, in terms of what we will cover today in our discussion, and of course, there'll be also time to share with you, to hear your questions and to share with you some of our answers. First, we're going to basically present to you what the ICHOM accreditation really entails, what are its main components, what are its different levels, and why. And then we're going to get into, do we need really another accreditation? How does ICHOM's accreditation complement, or how is it different from other accreditation, and how does it link to other existing accreditations? So that's going to be really the second topic of discussion. And then we're going to move into more the how-to. So actually look into who is eligible, what do they stand to benefit? And of course, within that discussion, although the accreditation is directed to providers, we're going to talk about how is this really important to regulators, patients, payers, and the industry, life science companies. So we're going to also get to cover that. And of course, at the end, we will talk about how to get you started.
Perfect. We're so excited for this conversation. Before we dive in, just a couple of housekeeping. If you have questions that you want to ensure that we get to during this conversation, please put them in the comments section, and our team will be monitoring that and making sure that Faris and I see those questions so that we can address them in the course of this conversation. We also are recording this entire presentation. It will be in perpetuity on LinkedIn, and there will be an opportunity to extend our conversation. So you'll be able to continue to put comments and questions into the LinkedIn space so that we can add information and address any questions that you have after today's session. So with that, I just want to share with you a little bit about ICHOM and why we undertook this initiative. So if you don't know ICHOM, we are a US-based nonprofit that has been working on a global scale for the last almost 13 years. We started with a really strong focus on working with patients to define what are the outcomes, both clinical and patient-reported outcomes, that are most important to them in various diseases. And our second decade is really focused on how do we spread, implement, and prove that this is the true way to get the best value out of healthcare. And when we say value, we mean what are the patient outcomes? How are we improving patient health and quality of life by using the most efficient use of resources? And that's our equation for value. It is born of the work of Elizabeth Teisberg and Michael Porter in their book, Redefining Healthcare. And that idea, that mission focus, was the genesis of ICHOM in 2012. And so we have the same mission today, and we work with organizations all over the world across a spectrum of efforts to not only define what's important, but then to guide healthcare systems, policymakers, patients, and others in how do you do this work. And so that's really our why for our involvement in the work that we do and in this accreditation program. Just a comment to say the central core tenets of our work globally have to do with co-creation with patients. We work with patients side by side, along with clinical experts and research experts, to define the outcomes that are important to patients in various diseases. And you can see this visual that really talks about diabetes, I believe, is the set that this comes from. So it really shows you that we are looking at whole health. We are looking at the clinical aspects, but we're also looking at the quality of life aspects that really come into play in a person's journey toward health. We focus entirely on the results of care, and this is unique, as you'll hear from Ferris in a few minutes. This is a unique perspective and one that's focused more on the outcomes than just on the processes of care. And it is both comprehensive and prioritized. By that, we mean it's holistic, it's whole health focused, but we're also training all of our eyes on what is the most important thing to be measuring and using as the guidepost for quality and value. And then you'll hear our hypothesis about the fact that this is, well, we know this is based in science, right? We use science to tell us what are the best-in-class instruments that are currently available for clinical and patient-reported outcome measurement. And this is real-world use in action. And happily, we have a global audience, a global community of practice. And this is why we stepped into the notion of accreditation. And with that, I would love for Ferris to share a little bit about CAPIDEV and why they joined us on this journey. Ferris.
Yes, and I think in keeping, Jennifer, with what you said about the next decade focused on really implementation and ensuring the widest adoption possible of the outcome sets that are really, in a consistent way across the world. What CAPIDEV focuses on is really realizing these various value-based healthcare initiatives on the ground. So we very much focus on, applied training that precedes implementation, and then accompanying through, clinical and data and payment model experts, the actual day-to-day implementation on the ground. So we kind of more downstream focused really on that work. And of course, we do help organizations prepare for the ICHOM accreditation, even though of course, we don't decide on it. This is in, ICHOM's decision to grant an accreditation or not. But we do all the work that is necessary to get organization to get there. And we're also a technology company, so we have an integrated outcomes management platform that actually is quite interoperable and makes CROMs, PROMs, and PREMs easy to collect and use. So we are really an implementation enablement company for value-based healthcare, and we're actually glad to, I would say, step up our partnership with ICHOM on accreditation because, again, accreditation is a way to be sure of to actually catalyze implementation and to be sure that implementation is being done in the right way with actually valid measurements for various outcomes.
Perfect. And we're so pleased that you stepped up to the proposition of partnering. We do at ICHOM have a number of partners all over the globe that have expertise in regions. And we continue to talk to them as well as standing accrediting bodies in different countries who are interested in aligning with us around this accreditation program. So we very much appreciate the leadership on the part of CAPIDEV and its capability. And we continue to expand our community to help us not only launch this, but to spread it around the world. So let's get into what we're actually talking about. For those of you that haven't seen announcements or information that we've shared as we've launched this program, this is our whole program in a nutshell, if you will. So the ICHOM accreditation program is focused on the condition-specific implementation. So first and foremost, this is embedded and grows out of the ICHOM standardized sets or the sets. So this is about working with healthcare entities around the globe on implementation of a specific health condition focused set. So for example, a diabetes or stroke or heart failure or breast cancer. And we have identified a tiered approach in which we are guiding these providers along the journey towards truly value-based healthcare. And so everybody, wherever you are in the world, your entity is somewhere on this path. And we deliberately established it as a journey, as a pathway. because we know from experience over the last 12 years that implementation happens at different paces. It has different barriers depending on where you are, what your political system, your culture, your resources. It also is a highly personalized journey. And so we needed to have a sense for how to grow organizations from where they are, where they're starting. So if you're a candidate kind of at the bottom, it's not bottom, it's an entry point. So think of it that way. And any organization that is interested or is already starting its journey of implementing an ICHOM set as a backbone of collecting data, both clinical and PROMS data, you're a candidate. And there are some, we'll talk about it, there are some assessments and ways that you can gauge your readiness to be reviewed for certification under the ICHOM accreditation program. And then we talk about the different levels. So you start as a successful implementer of the STET, you move to a more experienced implementer, and that has to do with data. And then you achieve the pinnacle, which is a true pioneer in value-based healthcare, someone who's looked to as a leader, a model, someone who can share learning. And this slide is a different view of the same pyramid, if you will. And it shows you a little bit more the main criteria. So at the level 1, we're really talking about you've implemented the set and you really have gone one full cycle in collecting data against the set. Now this has to do one full cycle. People will say, what's the timeline? What's a cycle? Well, it will differ depending on the health condition, because for some health conditions, you can gather data and within 3 months, you can see a signal that the outcomes are improving or that something's not right. With other, it might be more like 6 months or 9 months. So it will depend on the health condition that you're talking about. But this is level 1 really is about early stage. This is where, as Ferris shared, there can be a lot of intensive implementation, education, best practices, guidance if you need it on implementation. And the data collection is the most important element of it. Getting comfortable, making sure your systems are gathering the data correctly, all of that. Level 2, we're really talking about more extensive experience with data collection and looking at data auditing. How clean is your data? Is it really capturing the right things as intended by the set? And then most importantly, use of the data in clinical care and really considering what are the signals we're seeing? How is this guiding our clinical practice within a unit, within a hospital, within several hospitals, within a system? And then lastly, level 3, really we're at the run rate of high efficiency, high, kind of cultural norm of using this data to make decisions and guide quality improvement. At that stage, you'll be looking at publication and dissemination efforts. Like, how are you as an organization stepping forward to be a model, to be a center of excellence, to share your insights with the world? It's a really imperative that pioneers are sharing their learning for the betterment of everyone. So this is kind of the 3 tiers. And let me just pause and ask, Ferris, if there's anything you want to add about the levels, about the criteria.
I think one key thing about the levels is they are based on years of experience from multiple implementers that looks at things in a very gradual fashion, in a very progressive fashion. For example, in level 1, ICHOM doesn't require you to have collected the full set. We realize for many providers, it can be too complex. I mean, some sets have maybe 10 prompts to begin with. So the requirement here is to collect at a minimum the primary set or 50%, depending on the set, and depending on the individual set. And so this is already a good enough start. And that's why, it has been labeled level 1, because we've gotten really the process going. But of course, we need to make sure that there's a sound data collection and data usage approach in the provider organization. And then level 2, obviously, we become a bit more, demanding in the sense that in terms of the completion rate of the set, the response rate from patients, and of course, a more extensive data audit that is actually done on a sample of primary data, and also the usage of outcomes, obviously, because this whole accreditation is a combination of guiding and recognizing both collection of valid outcomes and also their use in, routine clinical care, clinical quality improvement, and research. So these are things that we obviously look at. And of course, level 3, this is really taking part of some of the big initiatives, global learning collaboratives, publications, where actually we have some results to show for. We have outcomes that have been, improved, that have improved as a result of this, of this journey. So this is a very gradual process. It is within reach, I would say, but it needs to be done in the right way. So for example, level 1 is within reach, but the change enablement that needs to take place initially may actually be new in order to, if the organization is doing it for the first time. So yeah, I guess, this is quite gradual and progressive. So.
And this is, yeah, thanks, Ferris. I want to share, this is just a different visual that we don't want to spend time on because Ferris just so eloquently laid out the purpose behind the levels. But this just shows you that it's true progression. And I think that that's something we want to make sure we emphasize and that folks who are joining us today are well aware of, that, as you just said, it's gradual and it's about building muscle in this space of measuring outcomes that are most important to patients. Ferris, why don't you, when we first started this journey together, we had long conversations about why is this needed, why now, and most importantly, why is it different than anything else out there? Because the word accreditation means different things to different people. It can spark fear in the hearts of some folks in hospitals. And we view ICHOM accreditation as a very welcoming, supporting environment that is really about guiding that gradual journey. So talk to us a little bit about your notion of how this differs.
Yes, I mean, absolutely, Jennifer. I think these are some very well-known, well-established, and great accreditation frameworks that have actually been adopted. At least 3 of them have been adopted widely across the world. And but the idea fundamentally here is that these accreditation frameworks, they define a number of standards, processes, skills, competencies, resources. They provide limited weight to health outcomes, CROMs and PROMs, or even some of them don't provide much weight to that. And of course, one of the 4 is actually condition specific in this case, which is the JCI Clinical Care Excellence Program. So we feel that the missing piece here is to understand what is the impact that these standards and processes are actually producing in terms of outcomes. And therefore, as you, Jennifer, described very well on the past couple of pages, the ICHOM accreditation is only based on outcomes, in the sense that we look in every medical condition, what outcomes are you able to achieve? What outcomes are you measuring first? Then how are you using? And then what are you able to achieve? And of course, that would be a complement to essentially these existing accreditation systems. If we go to the next page, Jennifer, maybe we'll see more of that complementarity. So in a way, those existing systems have, like I said, a focus on processes and resources, and most of them also are general to a provider, not condition specific as well. ICHOM is very much based on the ICHOM set, so clinical and patient outcomes and condition specific. And it's also gradual. So basically the milestones that need to be achieved in terms of collection and usage and impact are actually very well defined in a very discrete fashion. So there are specific points in the journey that basically providers can look at as goalposts, if you like. And so when you have centers of excellence in your provider organizations, in cancer, in cardiovascular, in stroke, in multiple sclerosis, and other areas, um, complementing any accreditation you have for these centers of excellence with the ICHOM accreditation would really make sure that you're really delivering outcomes. Not only that you have maybe the best doctors or the best equipment or the best certification, but that the outcomes you are delivering to patients, clinical and patient reported, are actually at the best that they can be. And so this is really the bridging and the linkage between the two accreditation. Of course, we still need to look at processes and standards, but we need to also look at outcomes. So if we bring everything together here, the ICHOM accreditation is a great way for providers to be recognized as value-based healthcare pioneers who are truly patient-centric in the true sense of the word, from an outcomes and experience perspective, and also clinical excellence. Because what better way to define clinical excellence than delivering great care to the great care possible to patients. There's also a linkage between the ICHOM accreditation and the Newsweek ranking, which is actually calculated or let's say managed by Statista. And there's actually a partnership between ICHOM and Statista to that effect. So in a sense, if you're measuring outcomes, if you get awarded the ICHOM accreditation, that will translate into an immediate boost to your Newsweek ranking. Of course, the other benefits of ranking is becoming a referral center for personalized care, especially around the centers of excellence where you actually look to be recognized. And of course, when I talk about providers, I do mean hospitals, ACOs, primary care, anyone providing any kind of care, of course. Of course, these measurements and this accreditation will enable benchmarking, because we are gradually accumulating data sets on clinical and patient outcomes in multiple conditions. And then this will enable us through learning collaboratives to identify what are the best practices and therefore, kind of disseminate their adoption. And of course, you have all the real-time data to make, treatment and care the decisions together with patients and to improve pathways. So this is really an important, I would say, piece in the puzzle to the delivery of really great care. And I think, Jennifer, maybe you might also tell us what's also in it for beyond the provider.
Yeah.
The providers, because other stakeholders also do stand to benefit and play an important role in that, in value-based healthcare in general.
Thanks, Ferris. And yeah, when we started this conversation about envisioning this partnership, that's one of the things that we both were very passionate about, is emphasizing that this benefits all of us. This is a mutually beneficial program. It's not just about guiding providers on the journey. So first and foremost, and probably dearest to my heart, is the patient community. I have spent 30 years working with a range of patient organizations, both in the US and around the globe. And I came to ICHOM because that at the heart, our alliance and collaboration and co-creation with patients is really the primary driver. It's why this organization exists. It's how we do our work. And we know that by guiding hospitals and healthcare entities around the globe to best practice and best form of implementation of outcomes measurement that is guided by what's most important to patients, patient communities gain. They gain in better quality of care delivered. They gain in better choices and understanding what those choices might mean for their own health goals. And they gain an advocacy tool. They gain resources that can help them articulate what their goals in care are. And it's done in alliance. This is not something that ICHOM envisions we're doing for patients. We're doing it with patients. So I think that's my primary emphasis. But we know that that there are other actors that will benefit. And Ferris referred to this early in his introduction. But for example, regulatory bodies. It doesn't matter what your system design is. Regulators have a common interest in understanding how do we get the best out of our system in a standardized way. And this is about driving a focus on outcomes. How do we improve patient health, population health within a given system? Regulators are primarily focused on that. How do we get the best out of our system for the best use of resources? This is the value equation that I talked about at the beginning. And so the focus then, as Ferris has shared, shifts from processes, how many screenings did we do? What is our adherence data? How many, what was our census over the last 30 days? It's not that those data points are unimportant. They are not the most important thing in getting the best out of our health system. And so this, what ICHOM does, and this accreditation process can help all of us make that journey to focus on outcomes that are most important to the patients being served in a given health condition.
Yeah, and Jennifer, maybe just on the regulatory, one of the things, I mean, obviously at the more basic level, accreditation is a scale-up tool. It's a way to make outcomes mainstream in a fairly, I would say, relatively high leverage fashion, right? In the sense that we are in discussions with various regulators around the world, and of course, at least one or two of them are beginning to endorse this accreditation as a way to make sure these outcomes are mainstream on the part of all the providers they have in their countries. So it's also at the basic level, it's a way to mainstream these measurements.
Yeah,
Just
and I think
pointed that out.
And I think that, yeah, I agree with that. And I think that that's a major focus of regulators and payers for that matter. They're looking right now, and what we see as a trend is that regulatory bodies and payers all over the world are looking for that guidepost. They're looking
Yeah.
for that standardization of how can I get the best out of what I'm paying for, what I'm responsible for overseeing. And of course, ICHOM's belief and our partners' belief is that it's about the outcomes. It's about, are you getting people to better health, better quality of life? That's ultimately the purpose of healthcare. And this is what we are offering is a way of measuring how are we doing and where are we on that progression to excellence. And the beauty of ICHOM sets and the work that we do is that it's both treatment agnostic and it's setting agnostic. So you can do these measurements irrespective of what your treatment patterns are, what resources you have available to provide treatments. That's not what it's about. What it's about is, are you improving people's health, whether they have diabetes or they're at risk of stroke or they're dealing with other chronic illnesses, even rare diseases. We know how to measure progression in both clinical aspects and in quality of life. What is lacking is a standard approach to doing it and actually doing it and using that data to tell us how are we moving the needle. This is a worldwide demand and need. And I think the regulators and payers uh, are activating more in asking these questions. And I think that the timing of the accreditation program not only elevates the work that we've done on 46 disease areas, but it also shows that there is an actionable way forward. And then the last sphere that you talked about a little bit, Ferris, was the industry, life sciences. I've had, in my career journey, I've had the pleasure of working with a number of innovative life science companies, pharmaceutical, device, and now we have a whole field of AI and technology-driven delivery of care. All of these entities want to be able to show that their product, their intervention has the best impact on health. That's fundamental to clinical inquiry and development and to the expansion of our understanding of how to improve health. But what we often lack in that space is clear guide points to tell us, are we getting the best out of the technologies and the interventions that we have? And we hear a lot of talk about the importance of real world evidence, about how to use that in new and more flexible and insightful ways. Like, how do we leverage AI and digital health technologies to help us learn faster? If we don't identify the point of those interventions, what are the outcomes that they should be expected to achieve, we risk running down the path of a technology that isn't based in patient-centered outcomes. And so I think this is an important opportunity for all of us to say that the point of intervention of healthcare, of any technology, tool, or process that we are using to guide health, has to be, are we getting the outcomes that are most important to patients? And again, that brings us back to the center, which is what ICHOM has been doing for the last 12 years and wants to continue to do on a global level. So I wanted, I went back one. Just before we are getting some questions come in, before we take some questions, I wanted to share with the global community that we have started this journey already. This is the formal announcement, and the partnership with CAPIDEV is really about enhancing and expanding our work in certifying healthcare entities in the use of ICHOM sets. And we're really happy to have worked with these three organizations that are global leaders in healthcare delivery to do level 1 accreditation already. And so in the case of GlueCare, they just recently had a peer-reviewed publication about their journey and the implementation of the ICHOM set and how it informed their journey and their changes in care pathway for people with diabetes. These are examples, and we hope as we really dig into implementation of this, we hope that this slide becomes much busier, or maybe even multiple slides, so we can showcase where there are leaders all over the world in doing this work. And the last, question that may be on your mind is, how do I get started? So just to say that we have a process. There's a QR code and a link here, which will take you to a page to express, like, hey, I want to learn more about this. I think that my institution might be interested in this. I would like to get us started on this journey. That will take you to the site. And there's also a readiness survey that you can access and kind of take stock. Are you ready to really start this journey? And once we've worked with you to assess your readiness, that's the point at which you formally enter the accreditation pathway. That's where we talk about what are the processes, timing, the fees associated with review of your application. What does it mean once you achieve certification? And then we do that review and, both publish that you have achieved a level of certification, as well as work with you to promote your achievements. So that can look at a number of ways, including through our newsletter, through abstract submission at our conference, all the way to, the brass ring of peer-reviewed publication. So Ferris, anything that you want to say about the how we get started before we take some questions?
Uh, I think the best way to start is, as you rightly pointed out, is, if you are on this journey or you're wondering how to get started, I would say do not hesitate to reach out on this link that was provided here. Someone from ICHOM CAPADEV could actually help guide you on this journey, where you are, where you should be going, where are maybe assess readiness. We have ways to also a checklist to assess readiness. So I would say, please do not hesitate to reach out at whatever stage in that journey you might be. We are certainly looking to see the widest adoption possible, which, as Jennifer pointed out, creates so many possibilities for learning and improvement and real-world evidence.
Great. I'm going to just stop sharing for a couple minutes while we talk about some questions.
Yeah.
So one right off the bat is how long is accreditation valid for? So our original envisionment is that the certification under the accreditation program is 3 years. And we do that to give people space to grow. And our hope is that some maturity happens over that 3-year period, such that then the next time you're at bat, you're pursuing the next level up, for example. But it also gives us a chance to see data and your progression and kind of give feedback on that journey. So it's not meant to be about us looking over your shoulder as much as it is about growth, learning, shared learning, and impact. Ferris, anything you want to add to that?
No, I mean, you're absolutely right. I think the accreditation, there needs to be some time to go from one level to the other. And of course, some will not stay at level 1, for example, for 3 years. They may be ready for level 2 earlier than that. But it's just that they're given this runtime in a way to really get there. I think there's also an interesting question on national audits and disease registries, right?
Agree.
And we fully agree with the, whoever asked this question. It is an enormous opportunity. In fact, in one of our projects, if I recall well, a couple of years ago, we had contributed to the design of such disease registries, stroke, CAD, and a couple of others. And I think, Jennifer, this is really part of our engagement with regulators and national bodies to basically align. I mean, obviously, the Swedish example of registries is one that's very advanced in, and ideally, we'd like the world to move in that direction. I don't know if you'd like to add anything about that, but I think we've been contributing to creating this alignment of our implementation and data collection with national registries.
Yeah, and I mean, Sweden is certainly an example, but there's examples all over Europe and even developing examples in the US and other areas. So we absolutely agree this is a logical alignment. Um, and also ICHOM is currently talking with a number of existing accrediting bodies, national accrediting entities all over the world. And this is not about taking over, this is about aligning. So when we're talking with some of these entities in Far Asia and in South America, the idea is how do we harmonize and not create more burden for hospitals that may be accredited by a national hospital accreditation body, but how do we bring these two things together, and how can ICHOM accreditation add value to that accrediting organization as well? So this is the beginning of our journey in this, and we take very seriously the importance of partnering and not reinventing the wheel. This is about how do we augment. And again, the principal purpose is how do we center our feedback loop in the healthcare delivery system in particular? How do we center it on the right things, which is about patient-centered outcomes? So, so agreed entirely with your comments and ours as well about partnering.
Yeah.
There's a question, I just wanted to say there's a question about um, uh, is there a measure of patient caregiver engagement? That sometimes patient-reported outcome measurement response rate might be a proxy, but doesn't necessarily measure self-efficacy. Happy to take that offline just to say that ICHOM sets include a variety of patient-reported outcome measures. And there are things like the patient activation measure and other tools out there. Our working groups review all the tools that are available to measure within a dimension, and they make decisions about which are the best in class as well as what's most accessible. So I'm happy to tell the audience more about that, or you can, we'll share how to get in touch with us. Absolutely can follow up on the more granularity about that.
Yeah, and I think on that also, it's important to look at something we try to always gain an understanding of, if not measure outright, is the level of attending clinicians engagement on the prompts. So how are they used in consultation? To what extent they're seen as useful in the process of care? Because that tends to signal. So I think this question is also an important one. There's also one, I think Q5 here on the adoption barriers and the readiness with index and actionable pathways. I think indeed we can, uh, you know, we can work with you to essentially assess two types of readiness. One is exactly where you are today and what is still missing in a way to get to level one, or maybe to get to level two or beyond. And secondly, we take a more internal look. So rather than just measuring where you are in terms of what you've achieved to meet the ICHOM accreditation requirements, looking more inward and looking at the organization's own readiness, systems, setup, processes, data, senior leadership commitment. So kind of organizational readiness and how far you are on an index to reach the ICHOM accreditation. So again, please feel free to reach out, and this is
Yeah.
something on a case-by-case basis, right?
Yeah, and I think, yeah, our readiness survey that we've put together for folks that are interested in this kind of assesses those areas. One thing I would say to the questioner is we also are on the journey. So this is also about how as we launch this and as we work with individual entities, we're also going to learn about what's needed, where there's more standardized resources. And we have multiple ways of addressing those. So it's not just about what can ICHOM build, it's also we have partners that have resources. We have, patient organizations that we engage with. There's any number of resources out there to help leverage improvement. And our philosophy is how do we bring the best together and in a standardized way kind of move all of us forward. So I think that's our orientation, and we would be looking to identify other tools that would need to be developed or other partnerships that would help us provide best-in-class support to that actual implementation journey. So I, again, hope I answered that question. Ferris and I we have a number of questions, and as we said, we will continue this offline. So continue to put your questions in the comment section. I Maybe we take two more. I think one is a tactical question. From start to finish, how long will it take me to be accredited? I know you won't like this, but the answer is it depends. And by that we mean it depends on your readiness. And that's why we start with some intensive candidacy in which you do some self-assessment and we really ask you some questions so that yes, I'm ready to actually be on this journey. If you've only just started implementing an ICHOM set and you're really new to the data collection, you probably aren't ready to be fully evaluated for accreditation. But we won't know that until we engage with you and actually explore where are you on the path and how can we help get you to where you want to be. Once we have that intake and we set up a review meeting and things like that, we're pretty confident that we can review an accreditation package pretty quickly. And Ferris, I don't know if you and Zofia have worked out a commitment, like here's the due date of an accreditation package.
Yeah, I think this is the question is when an organization is actually ready to be accredited. So everything is in place, an application, and basically the idea here is that we've established or we are establishing some sort of internally a booking system, right? Because sometimes you may have many applications coming in at the same time. And so I guess the question is like, if everything is ready, and you have been a candidate, so you've already registered with ICHOM early on in the journey, you will have 1 or 2 months, target months, if I may say, whereby you could apply and expect to have an answer within let's say a couple of months at the maximum. But of course, that assumes that you are ready, the file is ready by that time, and that you have already registered during the actual implementation or maybe at the start of it. So we encourage people to register. I think as Jennifer, as you mentioned, the candidate status is actually important because then we know who are actually implementing and who want to know where they stand. Are they implementing in the right way to be ready when the time comes to be ready? So we encourage you to let
Perfect.
us know.
Yeah, and so on that note, there are a couple of other questions we didn't get to today, but they're more geared towards the sets and like the actual implementation. So we will absolutely take those up offline. But
Yeah.
I wanted to, before we close out today, talk to you a little bit about. So first of all, here is our website and a QR code for more information to fill in the blanks of everything you've heard today. This is how you can find us. And I just want to leave you with, there's a number of events that are related to this that are about supporting organizations around the world on their journey. First and foremost, we have an additional ICHOM education program in which we are sharing the philosophy and kind of the leadership and strategic skills that are needed to really guide value-based healthcare around the world. And so here is some information about the ICHOM education program and some of the cohorts that are upcoming. Our next webinar that ICHOM hosts is actually going to showcase one of our accredited hospitals, Bangkok Hospital Pattaya. And that will be on Thursday, the 20th of February. So we hope you'll join there. And again, this will be recorded and made available for everybody if the time zones are not congruent with your life. And of course, our signature event is this fall in Dublin, October 1st and 2nd. This is the place to be if you're interested, if you're on this journey. We have abstracts that are presented from all over the world. We have 2 days of really intensive conversations about the how, practical application, practical solutions. How do you get beyond the barriers? It's a really energizing and important conference, and we are excited to welcome you to Dublin this year. And then we'll just close and leave this slide up for your use. This is how you find us and find more information. I want to thank you to the audience for sticking with us on this conversation, and especially thank you to Ferris for being on this journey with ICHOM. And we're really excited about this partnership, and we're excited to get going and really work with organizations on this journey.
Yeah. Thank you, Jennifer, and thanks to everyone. And I think any remaining questions, please really feel free to share them with us. We will certainly get back to you. And if I'm not mistaken, they will actually be posted together with the LinkedIn live recording. So we're very happy to answer some questions offline. I know there are many questions we could not answer, so we will surely get back to you. And
Perfect.
thank you.
Thank you, and have a wonderful day to everyone who's been in our audience. Thanks for joining us.